Notice that she touches the outer layer only. All kits, all drapes are double draped so that the nurses may handle the outer layer, leaving the inside layer sterile. She continues to monitor the patient by checking its eye reflexes and its withdrawal reflexes every few minutes. Once the cat is stable, the surgeon prepares to scrub, checking again that the autoclave tape has turned black, so the temperature has been reached correctly, opening the double draped surgical gown and checking the inner tape has turned black. The hand towel, the surgical gloves, ensure that it's of the correct size, opening it carefully. The scrub brush is the only item that is single wrapped in a piece of paper. Again, it can be autoclaved with a inside autoclave tape. This tape indicates that the instrument is sterilized correctly. Surgeons cannot have long fingernails or wear rings, as they cannot be sterilized correctly. Use an elbow operated dispenser for a disinfectant. Scrub each hand, starting at the tips of the fingers and moving to the other hand, scrubbing the fingers and hands 30 times, or 10 minutes for the whole procedure. Move on to the other hand on the wrist and work your way below. And scrub the other hand thoroughly, again 30 times. Drop the brush, rinse off the disinfectant with your fingers pointed up so that water flows to the elbows. Turn the tap off with your elbow. Drying of hands is crucial, as bacteria can still be present on wet hands. Use a simple hand towel that has been autoclaved, again checking that the tape has turned black. Use one corner for each hand. Wiping thoroughly, again working from fingers and down. Pick up the other corner and wipe the other hand the same way. Once hands are dry, you are ready for the surgical gown. Unwrap the second layer, checking that the tape has turned black, that is the autoclave tape as opposed to the outside tape. The nurse should assist you with the tying at the back. Notice I'm standing away from the table. Surgical gloves, place it carefully over your left hand. Place the other glove on, touching only the outside, and securely placing it over the sleeve of the gown. Return to the other side and complete the gloving over the sleeve. Always walk into the room with your hands above your waist, being careful not to touch anything to break asepsis. At this point in time, there must be minimal movement in the surgery and all doors should be shut. The nurse is handing over the surgical drape, again touching the outer, surgeon picking up the inner, checking that the sterilization tape has turned black, opening inner layer, checking that the autoclave tape that indicates sterilization is successful. The drape is open, again at above table height. Notice that we use drapes with different size holes for different patients. In this case, a small size hole is adequate for a small cat. Surgical kit is open, again checking that the tape has turned black. The instruments are laid out. In this case, just a couple of clamps is adequate for a small cat to keep the drape in place. Checking for landmarks, again, greater trochanter, wing ilium, point at intersection, double the distance, and the incision is made at a 45-degree angle. Once the incision is made, using red tooth forceps, gently dissect the fat layer. Notice that I'm cutting and then opening the scissors. Always use a blunt pair of scissors for dissecting tissue so that you don't traumatize the tissue. I've made a very small incision through the first muscle layer and opening it. Grabbing the second muscle layer, small incision, and again opening instead of cutting. That causes less trauma. It's important to grab the muscle layers so that you don't lose the hole. I'm grabbing the muscle layer with an Alice forceps, and that stays on throughout the surgery, so I know where that layer is. I've grabbed hold of the two muscle layers with the Alice. In the cat, the first layer is very thin. So I'm using the Alice to grab the second layer. And then I use one pair to grab hold of both layers together. So now I've got hold of both layers of muscle. If I need to widen the hole, I just open the scissors. Using a Spay hook, I locate the uterus, which is very superficial in the flank Spay approach. It is not deep, unlike the midline approach. Using a pair of carmelts, the carmelts have grooves running longitudinally. I clamp gently the ovarian stump or ovarian vessels and a second pair above it. This is called the two clamp technique. I pass on catgut sutures, and I'm going to tie in the area where the first clamp is. I position the suture over the first clamp. Now I notice that I turn over the clamp so that it's easier to see what I'm doing. Remove the bottom clamp and place it above the second clamp, and I'm going to make a tie where it's crushed and make 4 knots. Although there's only 1 knot shown, always tie it 4 or 5 times. And then I cut in between the clamps, which means I have hold of both ends. This is a very important step of all. You must inspect your knot and where you've tied. It's important to check that you haven't tied around the subcutaneous fat. Place the stump in and release. Do not release from the outside. Always handle the uterus very gently, and notice I'm handling it close to the hole and not pulling it from the top. Using the Spay hook, I locate the second horn of the uterus, again gently teasing the ovaries up. In a cat on heat, you must be very gentle. Again, using the clamps, clamp close to the tip of the instrument, because remember, you're going to be placing the instrument into the hole when you're releasing the stump of the ovary. Second clamp. In the cat, I would use a 3/0 catgut. You must use absorbables for internal sutures. Again, turning the clamps over will help. Removing the bottom clamp and placing it above the second clamp, and again tying 4 or 5 square knots over where you have crushed the ovarian vessels. Incision is made to cut the in between the clamps. Again, inspection of the knot, making sure you haven't tied to fat and that the knot is secure. Always place the instrument when you're satisfied. Place what you've tied into the abdomen, checking that there's no bleeding, and releasing it. Do not release until you're sure you haven't tied anything on the tissue on the body. Otherwise, the knot will stay with the muscle and fat, and you have got a problem. To ligate the uterine stump is the same principle. If there are large uterine vessels, you may ligate them separately, such as animal on heat or large animal. You may ligate the blood vessels separately and then tying around the stump, or you may ligate using a transfixing suture. Incision is made in between the clamps. Same principle of inspection, checking that your knot is tight, checking that the knot's not tied onto subcutaneous fat. Otherwise, when you drop the stump, the knot will stay at the top and not go with the uterus. Once you're satisfied, place the instrument in the abdomen and release while you're inside. To stitch up the